To some health matters now, while Nigeria still faces many challenges in its healthcare system, including a lack of resources and infrastructure, there is growing potential for health tech to make a difference. Innovations such as telemedicine, which allows patients to consult with doctors remotely, and digital health records, which can improve efficiency and patients' outcomes, are already being implemented in some parts of the country. With continued investment and government support, health tech has the potential to transform the healthcare landscape in Nigeria. Some of the main challenges facing the sector include a lack of reliable internet access and data privacy concerns. But these issues are being addressed through initiatives such as the National Broadband Plan and the Data Protection Regulation. And now in the studios, I'm being joined by Bayo Dioke, Country Lead, Head of Operations, Instant Rad Nigeria. Abayode, thank you so much for coming to our studios.
Thank you so much. Super excited to be here.
So we've been hearing so much talks about health tech, which basically would mean the infusion of technology into healthcare provision for people. Now tell us, at what stage are we now, and what are the benefits that healthcare in terms of health tech provide for people in Nigeria?
I mean, there's a lot of benefits as regards technology as it's driven in the healthcare space. And one of the benefits that we have right now is that we've been able to embrace technology to the point where we can now, we've gone to the point where patients really don't have to go to the hospitals to see a doctor physically for cases that are not, so critical. And that we've been able to, also have patients' medical images to be transmitted and reported, remotely, and without the patient having to be there physically as well. So, these are benefits that technology has, done for us, especially in the healthcare sector, where everything we do can now be digitally connected. Patients who are in the remotest, part of the country can have access to healthcare. However, I mean, in your introduction, some of the things you mentioned were, there are also some challenges that we face here and there. But trust me, we're a step, into a better direction with technology right now in Nigeria.
Now, of course, we know that this is a big break for Nigeria in the healthcare system or health industry. But then I want to believe, of course, there are challenges. And of course, one of the challenges would have to do with internet access. And like I read earlier, there are plans to provide internet services uninhibited for people who need to make do with it. What are the other challenges confronting health tech as a sector?
Yeah, so when we say technology, we're not just talking about things that can be transmitted from a particular location to another location. When we say technology, we're also talking about technical platforms that can be used even within a similar location. But the major challenge that we're facing right now, or we're going to be facing, forecasting into the future, will be that for healthcare, unlike other sectors like fintechs and the likes, healthcare is very, very sensitive. And healthcare products that we want to roll out have to be, specific to the facilities that we are working with. Let's take, for instance, we have the tertiary hospitals, we have the secondary hospitals, we have the clinics, we have the primary healthcare facilities. And imagine you installing a platform that was solely designed for a clinic in a public facility. Obviously, we are going to be facing we're going to be seeing areas and shortcomings where those platforms cannot function with the processes and modus operandi existing in the tertiary hospitals. So which means that when we're going to build platforms, the platform should be tailor-made. It should be built to the specific healthcare service delivery for the facilities that were installing the softwares. So when we're saying technology, it's not, for instance, in the fintech softwares, you have software that can be used, universally. It can be used by anybody. But in the healthcare space, it's different because the processes we take in the clinic is different from the processes we take in the tertiary hospitals. In a clinic, for instance, a doctor just sees the patient, prescribe a drug to the patient, and then sends the patient to, let's say, a pharmacy to get a drug, and then give maybe menial procedures in the hospitals. But in the tertiary hospitals, we have different different specialists, different consultants from urology to pediatrics to and this you can use the same platform for both. And the problem that we now see is that when you install a software in a tertiary hospital and it looks like it's not working, then we now get to conclude that technology cannot work for us, and then we have to go back to the orthodox way we have been doing things. So that way, if it is tailor-made and specific, there will be trust on the platforms. And it's difficult to change platforms to platform because of data privacy and all that. So that's why we have to get it right on the first instance and how we're going in for our embracing technology. We should be more specific to the service delivery at the different cadres of the chain.
So what role can the government play in supporting the growth of health tech in Nigeria?
So first is regulation. I mean, I could see it in the budget review that was released that a lot of the budget was 5% of the budget was allocated to healthcare, and about a chunk of it was allocated to the federal Ministry of Health and its agencies. And we need to embrace our regulation. Should be in line to embrace technology in our healthcare service delivery. Take, for instance, we have EMR solutions, we have teleradiology platforms, there's a new technology platform that we're even looking at recently, which is an hospitality platform where patients now are able to have like an advocate in a platform where they can make informed decisions on their on the healthcare processes. The way healthcare is right now, every patient is at the mercy of any doctor that you're engaging with. But if a patient needs an advocate that can give second opinions, that can help you make a good decision throughout the chain, the value chain that you are going to be interfacing with the doctors. Okay. So the government, what we need is more regulation. 2, we need more funding into healthcare, health tech. And another things that we can mention now.
I probably would need more specialized hands in that field too. Thank you so much, Abayode Oke, for talking to us at this time.
Thank you very much.